Well, good morning, everybody. Thanks for being here on this beautiful day in Austin, Texas. This is our fourth Engage and Excel conference that we've had. The design of Engage and Excel is for all of you over the next day and a half to spend time together talking to people, experts from here in Texas, experts that we've gotten to know from other parts of the country and the world about these issues.
As the Chief of Police, one of the things I'm looking forward to being here at the conference is networking with people from other communities, seeing what they're doing well.
One of the things that we have in Texoma is a behavioral health leadership team. I attended this last session with our chief of police, and one of the things that we're working on is jail diversion, and so we were able to look at other models.
It's important to get together to trade stories, to motivate one another and share experiences.
One of the most exciting things I heard was some of the discussion around the state's investment in child and adolescent mental health policy.
I'm really excited to see that EMS and even like the first responders are starting to integrate mental health professionals.
I had the strongest takeaway from was the social determinants discussion, and that I am taking home.
And social determinants of health are really all of the factors that affect our health and well-being. Education, where you went to school, what neighborhood you grew up.
I think Engage and Excel plays an integral role in teaching people that this is healthcare.
And I think Engage and Excel's also reminded me that we're all in the mental health profession here. There's a lot of people.
You often hear, things like compassion fatigue and people kind of being tired in this space because, it takes such a long time to make changes. But what I really feel excited about is that that's not present here. There's a real sense of energy and knowledge and drive.
75% of adult mental illnesses can actually be traced back to childhood.
But my biggest hope for Texas is that we treat mental illness as a child illness, because half of it happens before age 14, 3/4 before your brain finishes developing in your early 20s, and we do not want Texas children alone with this stuff.
I would love to talk to you guys about how do we bring your resources to a place like Texoma.
We had a student and they made too much money for Medicaid, and the father worked at a job that didn't provide health insurance. So we created a care plan that worked for them within the structure of what we were able to do.
We've heard it's really challenging to keep and maintain bilingual therapists.
Sometimes, we have to go look for translators, and we get the parents to advocate, and then of course the principal in there, so it become a team.
I want to say to all of you how very much I always appreciate being in a room with my people, my tribe, as it were. You are here because you work in this area, because you believe in this stuff, because you want to see change happen in our lifetime. And I appreciate the fact that I am not alone in this struggle. And so thank you for being here with me. Thank you for your presence here at this conference. Thank you for being part of the army that is on the front line attacking this problem.